Ladies and gentlemen, thank you for your patience in holding. We now have your speakers in conference. Please be aware that each of your lines is in a listen-only mode. At the conclusion of today's presentation, we will open the floor for questions. At that time, instructions will be given as to the procedure to follow if you would like to ask a question. I would now like to turn the conference over to Mr. Chris Hund. Sir, you may begin.
Thanks a lot. Welcome, everybody, to the September monthly webinar for the TeamSTEPPS National Implementation Project. It's hard to believe it's already September and summer's gone and school has started, and here we go. The topic for today is TeamSTEPPS in long-term care, financial and safety benefits of implementing TeamSTEPPS in nursing homes and LTC facilities. So thank you all for joining. Just a little bit about this project. We always start these webinars with a very quick overview. I'd like to start by thanking the project sponsors, particularly Dr. Jim Battles from the Agency for Healthcare Research and Quality. And AHRQ is the organization that funds and makes the national implementation, all of our trainings and webinars possible. I'd also like to thank Heidi King from TRICARE in the Department of Defense. The Department of Defense has always been a very close partner in all of the TeamSTEPPS work and was doing TeamSTEPPS before there was a TeamSTEPPS, and so always like to thank Heidi and her team at DoD. The project team includes myself. My name is Chris Hund, and I manage the national implementation of TeamSTEPPS. And I'm from the Health Research and Educational Trust. AHRQ is part of the American Hospital Association. We are the nonprofit research and education arm of the AHA. I'd also like to thank Impact International, David Baker and his team. Impact is our partner in crime on TeamSTEPPS and provide significant help both in evaluation and content and a lot of help in setting up all of our webinars. So thank you to Impact. So basically the TeamSTEPPS Master Training Program, we offer 2-day training courses, which are a train-the-trainer approach. And what this does is it prepares people to go back to their institution as a master trainer to kind of spread the word and teach others in all of the fundamentals of TeamSTEPPS. So that is one of the main things that we do in this project. But we have other things as well, and one of that is providing support. And so on this page, you can see a phone number and an email address that are both useful in case you ever have any questions about the TeamSTEPPS program, both content questions as well as questions about how you go to trainings or where you can find more information about our webinars or national conference. And all of these, this phone number and email address is also available at the website teamsteppsportal.org, which is actually where you went to start your registration process for this webinar. So just a few rules of engagement about today. We really encourage that you submit any questions via the discussion area that's on the left-hand side of your screen. At the end of the presentation, I'll moderate a Q&A session where I'll take questions from the discussion area and work to kind of craft a line of questioning for our presenters. If we come to a point where we don't have any more time for questions and we haven't gotten to all of the questions, what we'll do is we'll make sure that these questions go to our presenters and we'll provide written responses to them on teamsteppsportal.org. So that is something that you can look forward to. If we do get through all of our discussion area questions, we'll open up the phone lines in case anybody feels more comfortable asking their questions verbally. So tonight, I'd now like to introduce our webinar presenters for today, and we're very, very happy to have 3 presenters today with different backgrounds and a different view on this topic. Our first presenter is Michelle Pandolfi, the Director of Consulting Services at QUALIDIGM. Michelle has played a central role in designing and developing the TeamSTEPPS curriculum that has been adapted for long-term care. So there is an entire version of TeamSTEPPS that is very specifically for a long-term care environment. Our second presenter is Sharon Kostboth-Harper. Sharon is the Project Director of the TeamSTEPPS and Patient Safety Initiative at Tealwood Senior Living. Sharon and her team are at the beginning stages of implementing TeamSTEPPS in their facilities. And our third presenter is Erin Howe. Erin is a Doctor of Nursing Practice at Ewing Continuing Care Center and is also on the assistant faculty at the University of Rochester School of Nursing. She has implemented TeamSTEPPS tools in long-term care facilities, and she's here to tell us about her experiences with that. So a quick overview about today's webinar. Each of our presenters will be focusing on a slightly different aspect of TeamSTEPPS in long-term care. First, we'll be reviewing the long-term care version of the TeamSTEPPS curriculum and the adaptations that were made to be more in line with the long-term care community. We will also see a high-level overview of the financial and safety benefits of using TeamSTEPPS. Secondly, we'll hear from a TeamSTEPPS user who is in the beginning phases of implementing TeamSTEPPS and is in the process of developing the implementation plan. People are always very interested to hear about implementation plans, that how do you do it, what do we do when we try to do this at home. And then lastly, we'll hear a success story of implementing TeamSTEPPS tool in a long-term care setting and the outcomes that resulted from using this tool. So more specifically, as you listen to the content today, we hope to achieve the following objectives: to describe how the TeamSTEPPS curriculum has been adapted for the long-term care setting, to discuss the financial and patient safety benefits of TeamSTEPPS in long-term care, to highlight the importance of implementing TeamSTEPPS in long-term care facilities, and encourage the long-term care community to use TeamSTEPPS tools and resources, to describe steps taken to reach the planning process and develop an implementation plan, and finally, to review an example of the implementation and outcomes of TeamSTEPPS in a long-term care setting. Thanks for bearing with me. I'm not going to take up any more of your time. I'll join you at the Q&A, and I'm very happy to turn this over to Michelle Pandolfi. So, Michelle, you may begin.
Great. Thank you so much, Chris. Welcome, everybody. Thanks for joining us today. My name is Michelle, and I do work at QUALIDIGM, which is the quality improvement organization in Connecticut. We also do a fair amount of research and consulting services across the continuum of healthcare. I'm going to advance the slide, and we'll get right into it. So TeamSTEPPS, there are some key principles, and the long-term care version of TeamSTEPPS still has these same key principles. We have team structure, which delineates fundamentals such as team size, membership, leadership, composition, identification, and distribution. Leadership, which is the ability to coordinate the activities of your team members by ensuring that team actions are understood, that changes in information are shared, and that team members have the necessary resources to do their job. Situation monitoring, which is the third key principle, is the process of actively scanning and assessing situational elements to gain information, understanding, or to maintain awareness to support functioning of the team. That's a little bit of kind of watching each other's back to make sure that we're going to have the best possible outcome. Mutual support is the ability to anticipate and support other team members' needs through accurate knowledge about their responsibilities and workloads. And communication, which sometimes I feel is almost the most important part about it, is the process by which information is clearly and accurately exchanged among team members. Without good communication, we're not going to have good outcomes. So why long-term care? We were approached by AHRQ to actually create a long-term care version because long-term care, the environment's unique. It's different from a hospital environment. First of all, we have patients that we really call residents, because in the long-term care environment, you may have somebody living in your nursing home or in your CCRC for many years. It's not, a 3-day length of stay or even a 2-week length of stay. Sometimes it can be much longer than that. We have care teams that are multidisciplinary, and they include non-clinical staff. So when you're thinking about who can impact the resident's day, have an impact on their outcomes, it's really every level, from somebody who may work in laundry or dietary all the way up to nurses and the director of nursing. There are approximately 16,000 nursing homes in the country, and that equates to about 1.6 million nursing home residents across the country. Interestingly enough, this 1.6 million really only counts for those long-term residents, those who live in the nursing home for multiple months and years. We actually hit another 1.8 million who pass through the nursing home doors that may be there for short-term rehab. So that's about 3.4 million people, each year within long-term care. So that's a lot. So the focus on the long-term care version, what our hope was to do with this was really to update the materials and make it relevant for long-term care providers. So we updated text and any kind of training material to make it meaningful. We specifically looked at the language. We wanted to make sure that the language was appropriate for how people would be able to understand it and then put it into the context of their everyday work. We updated the exercises, the scenarios that are used, the tests, and the videos, and we made those center around both chronic medical or rehabilitation circumstances. The graphics and the pictures reflect the nursing home staff and the care and the environment of the nursing home as well. You can see on this next slide that we updated some of the penguins, because the penguins in the hospital version mostly had scrubs on, maybe a lab coat here and there. They're very focused on a hospital type of version in acute care setting. So we updated the group here, and this is our long-term care team. You can see, I'm trying to advance the slide here. Not working. But you can see that, there we go. We have our chef. We have our nursing assistant. We have Rosie, the housekeeper. We have our social worker, our therapeutic recreation person, our activity staff, our nurses, and, of course, the administration. And it was important for us to highlight everybody that may be on the care team because, that relationship that residents may have with the housekeeper or somebody who comes in to put away their laundry, those staff members have the ability to really pick up on some subtle changes that may be happening. They may not necessarily be able to do a clinical assessment, but, something in their gut is saying, Mrs. Jones just doesn't seem herself today, or Mrs. Jones mentioned this to me that's going on in her family. It may affect, her outcomes, whether it be, psychosocial or whether it be clinical. And so it's important that the entire team is represented. The implementation of TeamSTEPPS, what we did when we were updating the materials is that we actually talked about it. We piloted it in a facility, and we tried to make changes. So the evidence was tested in long-term care leadership and staff. We actually piloted this in a CCRC, or a continuing care retirement community. So it had leadership and line staff from both the nursing home as well as from an assisted living and independent living on a continuum. We adjusted our information for the audience. So we looked at education levels as well as English proficiency. And that'll happen a little bit with the presenters as well. As long as you know your audience and who you're presenting to, the topics that you discuss and the examples that you use may differ. We were able to share experiences and stories, and we encouraged that from the audience as well. And so they were able to really apply whatever skill we were teaching to their own work. For SBAR, for example, some of you may be familiar with that, which is a structured way of communicating. That was, we use it a lot with nursing, but it's not specifically for clinical. We can use that with the maintenance staff and the physical plant staff. And so we're able to apply that and give examples to everyone. We provided supplement lectures and exercises so that you could exchange out case studies and examples and exercises depending if you had clinical or non-clinical staff present. We suggest that you hold brief yet frequent learning sessions. What we found is we did this training in a long 8-hour day. And it's a lot of information to learn, And though it's hard to get people, off the floors and into a training within long-term care, we found that if you break it up, people were able to digest it a little bit further and be able to really take it and try to implement it slowly over time. And then we focused a lot on the communication skills. What we found is that that was the section people identified most with and were hungry for more. So if you're going to teach TeamSTEPPS in long-term care, I would say spend a lot of time within the communication module. We did create long-term care videos, and there are 2 videos that are available for when you're teaching. We had a long-term care scenario where it showed a subtle decline of a resident over a 24-hour period. And then we have a subacute care situation where it's a possible MI or PE in a resident receiving physical therapy. And the reason why we did that was, again, to be able to apply it across all the staff within the facility, whether you work on the long-term care unit or not. And the videos, we show 2 ways. We show it if you don't use TeamSTEPPS, all the things that can go wrong, and then when you use TeamSTEPPS, what goes right. In those videos, we highlighted 14 of the 15 TeamSTEPPS skills, and we excluded timeout because that one was specifically for hospital, and it didn't really fit mostly in long-term care. So what's new? Really the videos and discussions, the skills and the scenarios, that's all really new. The language we changed and the scenarios we changed. We have some exercises and scenarios that talk about care planning. We make sure that we bring in the team, so we have multiple different members, and we made sure that we had a slant for the non-clinical application of TeamSTEPPS as well. So investing in TeamSTEPPS. Unfortunately, there's no hard and fast data within long-term care. It's all really based off of the hospital setting. But when we look at healthcare in general, patients are safer in healthcare delivery systems where teamwork principles are practiced. That has been evidence-based for a while now. The information here about the annual cost of medical errors is actually based off of the 1999 Institute of Medicine study. And, the kind of talk now is that may have been vastly underreported, and they're thinking this may be as high as 4 or 5 times more. And communication failures, when you're looking at healthcare, is the leading cause of the preventable patient deaths. And when we look at root causes of sentinel events that happen within healthcare, they all go back to communication. So kind of the costs and maybe the benefits of what we find with TeamSTEPPS is that you have the potential to decrease your malpractice claims, decrease your insurance premiums, decrease your litigation. There is the ability to reduce the rate of adverse drug events. Some examples here from 30 to 18 over 1,000 patient days. Reductions in staff turnover rates, which can be a huge cost savings to nursing homes. It ranges anywhere from $3,000 up to $8,000 just to replace a CNA, an LPN, or an RN. Increased teamwork and communication will happen when you implement TeamSTEPPS and you support that throughout your organization. You can have improved med reconciliation. Here are some examples from the hospital as well, 72% up to 88% at admission, and then from 53% to 89% at discharge. And then an increase in employee satisfaction rates. And we all know when you have happy staff, they stay longer, so you decrease your turnover rates. But when you have happy staff, you also have happy residents because they're excited to be there and they take great pride in their work. That's a little bit about what we updated for the long-term care version. This is my contact information. Please feel free to send me an email or give me a call if you have any questions. And I will turn it over to our next speaker, Sharon.
Thank you, Michelle. Hello, everyone. I'm pleased to join the call today to discuss Tealwood Senior Living and where we are on our TeamSTEPPS journey. Tealwood is headquartered in Bloomington, Minnesota. The company owns or manages facilities in Minnesota, South Dakota, Iowa, and Nebraska, where we serve over 1,200 residents. We offer a full menu of services, including independent living, assisted living, long-term skilled nursing, and short-stay rehab. Our TeamSTEPPS and patient safety initiative includes 14 skilled nursing facilities, all located in Minnesota. 2 of the 14 are outside of the Tealwood family, but have been invited to join us in this initiative. They are currently with Elder Care of Minnesota. So 14 in total will be participating. The grant supporting our initiative was awarded by the state of Minnesota's Performance-Based Incentive Payment Program, otherwise known as PIP. Our Tealwood Vice President of Clinical Services and Vice President of Operations researched and actually wrote and submitted the grant, and we were pleased to be awarded the grant. Our focus is on patient safety through the application of teamwork and technology. And our key focus areas include pain management, medication errors, falls, and pressure ulcers. Through research, TeamSTEPPS was identified as a program that not only offers a very rich content, but importantly, proven results in enhancing teamwork leading to improved patient safety outcomes. And of course, resident patient safety is always front and center for us. Our approach by design is to engage the participating facilities by building an understanding of the program and the potential positive outcomes if it's fully embraced, because we all work in very busy environments, so it's important for our facility leadership and the staff to understand the benefit that can be gained from a full commitment to the program. And we approach this a number of different ways. We communicate, be it written memos, a newsletter, progress updates, flyers, meetings, conference calls, a number of different ways we communicate with our employees. We offer training at multiple levels. We do both informal and formal assessments. We monitor progress. And then we offer support. And support comes from a number of different individuals. And, of course, as the project director, I'm critical in that support network. Important to the success of the initiative is the teamwork and team effort at our facilities, particularly with those who provide direct resident care. And TeamSTEPPS content will provide us with the information and the basis for our team training. Each facility will develop an action plan unique to that facility based on the outcome of their assessment. And with patient safety as our focus, sustainability becomes a very important component of the program. So, understanding that, we are considering a number of ways in which we can effectively maintain the momentum gained during the introductory and implementation stages. For example, one of the things that we will be doing is as new staff members come on board, we will be introducing them during new employee orientation to TeamSTEPPS and the process. Supervisors will, of course, be held accountable for maintaining the process and the systems that are implemented. Those are just a couple of examples of ways in which we hope to sustain all of the momentum and the systems that we put in place. So, start at the very beginning, and we are at the very beginning of the process. I joined Tealwood Senior Living on August 12th as the project director. I attended the master training course at Duke University on August 22nd and 23rd. Today is September 11th. So you can see that we are in our very early stages of this project. We have, though, at this point in time, introduced the program, my position, through a communication to all of our employees. And we've also had an introductory meeting with the 2 facilities that are joining us outside of the Tealwood family. So we've sat down with them, we've talked about the project, what it means for them, and some of the early next steps. And I've also started my initial facility visits to the participating facilities. Since I am new to the organization, one of the things I felt was going to be critical is for me to actually be on site, see the facility, visit with the leadership teams, get a sense of their services and the culture at large. So I've started that process and will continue as I'll explain more. So that's where we're at today. So what are we planning going forward? We'll follow the TeamSTEPPS model, which will become clearer to you as I progress through the slides. First of all, we have our kickoff meeting, which is scheduled for October 15th. The participating facility leadership members, which for us is the executive directors and directors of nursing, will be there, as will our senior management team, and we're going to bring them all together and provide some more detailed information about TeamSTEPPS and our initiative. We will be identifying members of the steering committee, and that committee will be an interdisciplinary team across multiple facilities. We need all of that experience and expertise from different perspectives to come together to provide that guidance as we move forward in the process. I'm going to continue my initial visits at each of the participating facilities through September and into October. And at that point in time, what I'm doing is I'm introducing myself, I'm becoming acquainted with leadership, I'm meeting line staff, and just being present gives me that wonderful opportunity to initiate discussions about TeamSTEPPS, talk about our objectives, and establish connections. Simultaneously, we're in the process of developing our formal assessment tool. TeamSTEPPS has a wealth of information available, offers multiple templates from which we can build our customized assessment tool. Some of them are a TeamSTEPPS site assessment profile, team assessment questionnaire, team performance tool. Tealwood, in and of itself, has just completed their 2013 employee engagement survey, so the outcome of that for the facilities is going to be important to consider in designing our final tool. And as I mentioned, it's going to be a customized document that we will develop utilizing the templates and the information that we currently have available to us, but making it specific to that facility and their needs. And then following the assessment, of course, comes the analysis of the information, and we'll meet with the facility leadership to discuss the outcomes of their assessment. Okay, that leads us into building the action plan. So once the assessment is done, we have some understanding of where there are opportunities at the facility as it relates to our focus areas. We will then work with the facility to develop their unique action plan. That then moves us into the second stage of planning, training, and implementation. So an action plan is great, but unless we execute against the action plan, it's all for naught. So what we will be doing also is identifying at each local facility what we call a champion or program coordinator that is on site. This person is going to be crucial to the success of the program as we see it. Some of the characteristics that we think are key for this person, the champion, are enthusiasm. They need to have a cooperative spirit. They need to demonstrate team leadership skills. They need to have long-term care experience at a level where he or she is comfortable performing their job and understanding resident needs. And this doesn't necessarily need to be a formal leader in the building or a clinical person in the building, but someone who has these abilities and skills and is also capable of conducting on-site training, because the champion will be doing some training with the staff on the materials that we have identified for their facility. So it's going to be important for us to carefully work with the executive director and the director of nursing services at each of our facilities to identify the right person in that role. And that will be a key person that I, as a project director, will work with and support as we go through the process. I'm going to be conducting the Train the Trainer sessions with the facility champions. And, of course, as I mentioned, I'll continue to support them and assist them, be the resource that they may need as we move forward. And then together, leadership, the champions, myself, others, will work together to develop the timeline and actually begin the implementation of the action plan. That takes us into the final stage, which is a crucial stage, of course, because it means that we need to then, once implemented, continue to coach to make sure the process is fully integrated on a day-to-day basis and monitor for progress. And then, of course, identify any opportunities that may present itself. So, in my role as project director, I'll continue to monitor progress by making my on-site visits, offering additional training if it's needed, reviewing metrics, delivering feedback to the facilities and the senior management. I plan to create a newsletter and other written information that I can provide as updates as we move through the process. And then, of course, serve as that available resource and guide. So once it's in place, we need to monitor. We need to see what progress we're making. And then as we identify progress and we've made gains, we need to do a good job of communicating that back to the staff so that they are too aware of all the hard work and the effort that's gone into it and the payoff that they can then see. So, enjoy the positive outcomes. It is a collaborative process. There's no doubt about it. It takes people at all levels to support. Our senior management supports the effort, the time, and the resources through the line staff in each of the facilities. It takes each of us working together to enjoy the best possible success. So we're going to find ways as we go through this to celebrate the success. We can't forget to do that. We need to have some fun together and to celebrate together and, again, announce the progress that we're making. I also want to make sure that we have and plan a special appreciation event for individuals who have gone the extra mile, you know, our steering committee members, our local champions, the executive directors who have been fully supportive of the process. So there's a number of people that we will want to especially show our appreciation for. And then finally, I wanted to add this slide. This is from the TeamSTEPPS material, and it's a great graphic of what I've just described to you, and it's the basis for which we have developed our outline or plan. And it takes you through the 3 phases and kind of steps you through in a visual way, which for those of you that are visual, as I am, this is a great depiction of the process itself. So that's where we are. That's where we're going. We're excited about the initiative. And I clearly, as the project director, look forward to working with staff at all levels within the organization as we continue to shift towards and maintain a culture of patient safety, resident safety. Thank you all very much. And at this point in time, I'm going to turn it over to Erin Howe.
Great. Thank you very much, Sharon. I appreciate that. I'm glad that you all have tuned in today. I wanted to chat with you briefly about my capstone project that I presented in Dallas at the National TeamSTEPPS Conference this year. And today I'm going to focus a bit on the implementation and outcome phases, but I wanted to give you just a little bit of background about the project. My nursing home that I had previously worked at, the Jewish home in Rochester, we were having significant turnover issues with our frontline staff, our CNAs, on our transitional care unit. And as the research shows, loss of this very important part of the team can impact how the team functions as a unit, from both the family to the patient. It can create safety issues if we have staffing shortages. And some preliminary research that I had done, I did some surveying, identified that some of the problems that we were facing really related to communication and teamwork, and that this was a big reason that we were losing our frontline staff. So I created a program that focused on how we can empower our staff to improve their quality of work life or their job satisfaction. So why is CNA empowerment so vital in long-term care? The research shows that CNAs in long-term care face the greatest physical demands, the highest exposure to violence and role conflict. They have the lowest sense of control, the littlest role in decision-making on the team, and the least level of positive challenge. In effect, making this group of caregivers the most disempowered group within our long-term care setting, which is a significant concern to us. So in order to counteract that, there we go, I created a program using this CNA Empowerment Model. So in order to empower your staff, these 4 components in red are vitally important. And CNAs rate themselves as being fairly competent in their job. They feel that they're good at their day-to-day tasks. And they often rate themselves as finding meaning in their work. But where they don't rate themselves so highly is on impact, so their ability to have an effect on the decision-making of the team, and autonomy or control over their day-to-day roles. And so using this and using the TeamSTEPPS strategy of debriefing, I created a program. And for those of you that are not familiar with TeamSTEPPS, debriefing is a brief gathering. It tends to be informal of the staff, and it usually happens either after an event, like in the hospital after a surgery, or in this instance, we developed it to occur at the end of a day shift. And the crux of this program was that the CNAs, in order to give them a voice and to empower them, was to allow them to design the actual logistics of the debriefing. So where we would meet, who would be invited, how frequently we met for. And then the CNAs were actually charged with facilitating this debriefing. And they very simply asked the staff these following 3 questions. What went well today? What can we improve on? And what do we need in order to improve? And midway through this program, which the actual intervention was 4 weeks, we had a brainstorming session, and we discussed how are things going. Do we think that there are things that we could be doing differently that would be beneficial? And the design of this was to, again, allow the CNAs to have ownership over the program, to feel that what they had to say was vitally important. And then at the end, I did focus groups and interviews with the staff to assess how their experience with the program had been. So the specific aims were that this process of developing and implementing a communication program would lead to improved empowerment, improved quality of work life or job satisfaction, and reduced turnover in the following 3 months from the program. I utilized this survey tool, the Quality of Work Life Survey, which has been used previously both in nursing homes and in hospitals. And I selected this survey because I believe that it most fully captured the components of empowerment that I was interested in, so that being competence, meaning, impact, and autonomy. And this alpha coefficient is just a score that looks at how good the scale is, and it was a pretty decent scale. So the intervention took place at the Jewish Home on the Transitional Care Unit, which is a subacute rehabilitation floor. And we had 2 wings on the same floor, the northeast side and the southwest side. So it's actually a 68-bed rehab unit, which is fairly decent sized. And our participants were both the CNAs and the nurses. That's the data we collected on them. And the entire project lasted 16 weeks. So we started on the Northeast Wing, and the training included doing TeamSTEPPS training to initiate them, to have them understand the philosophy and the principles behind TeamSTEPPS. And then we implemented the program, and then we did the evaluation phase, and that was then replicated on the Southwest Wing. So to share the details of the implementation, because as most of you working in a nursing home are probably interested in how this actually looks, we faced lots of challenges, actually. The Northeast Wing opted, the CNAs decided that they would like to proceed in the charting room, and they wanted to invite just their primary CNAs and the nurses to start, so it was just the primary team. And as you can imagine, most of your charting rooms, it was difficult to gather the staff at the end of the day. Our nurses were sometimes in the middle of med pass. Call bells would be going off, so people would leave to answer the call bells. Phones would ring, so it was definitely challenging in the first 2 weeks. And due to a lot of the issues with communication and teamwork that we had faced, it was a pretty emotional process for the staff. Sometimes people would cry. There was a lot of frustration. And they felt, though, that though we were discussing a lot of the issues, we weren't really coming up with solutions to the problem. So at the midway point, after 2 weeks, we sat down, and the CNAs decided that they wanted to invite the other disciplines. They wanted therapy to be there. They wanted social work to be there, because a lot of the issues were team issues that they couldn't fix on their own. And they also decided that we should really move to the dining room, because the charting room was just too crazy of a place to meet. So over the final 2 weeks, we met with all of the different disciplines at various times. Different sessions were with different disciplines, and it became more of a roundtable discussion. And they came up with great solutions to problems, little things such as family members were going into the refrigerator and offering their parents food, and they were concerned about the hygienic nature of this, and also they were giving them maybe the wrong consistency of food. So these were concerns, and the dietitian, not realizing this was going on, was able to make some changes to resolve that issue. After the program had ended, it actually had been so well received that they opted to continue with these meetings on a monthly basis. So that was a good success. Then we had a very different experience on the southwest side. The CNAs opted at this time to start off in the dining room. And we had a harder time drawing the nurses to these debriefing sessions on this wing. But the process was very different. The CNAs would be waiting. They didn't actually get up during the sessions to answer call bells. And it was more of it was a calmer experience for these caregivers. And oftentimes with TeamSTEPPS, you'll see this, is that when you implement in any unit, in a floor, it's a totally different culture. And so what you'll see is that you'll really have a very different experience, which is one of the great benefits of TeamSTEPPS is that it is so adaptable and flexible to the culture that you have. So at our midway point, the CNAs decided that this was working well for them. They weren't interested in changing the location or the format, but they did feel that at the second end of the program, after they were more familiar with it, that they felt a lot safer to express their concerns and discuss the problems that they were experiencing on the unit with communication and teamwork. So there was an interesting climate change from the beginning of the program to the end. And initially, once we had implemented, the staff occasionally we would have back-to-back debriefing sessions, and the staff would say, "Why are we meeting? We just met yesterday." But as things progressed, the staff, I'd see them in the hallway, and they would ask me. They would say, "So, are we doing that debriefing thing again?" And by the end of the program, there were several instances where the staff actually sought me out, and they said, "We know we're not scheduled to have a debriefing today, but we've had a really stressful day. It really helps us to sit down and talk about things. Would it be okay if we met?" So it was really interesting to see the attitude and behavioral change surrounding these debriefings. It became something that was beneficial to them, which was exciting. And here are some of the results. So this was the Quality of Work-Life Survey that I had implemented, and I gave it to them both before we started the program and then after. And as you can see, in all the 5 subscales that I was measuring, the dark blue indicates an increase in scores from pre-test to post-test. And with the exception of one subscale there, we had a very positive response on both wings. So this was a good success. This is how we measured that their job satisfaction was increasing. And in addition, the third variable that I had been looking at was turnover. And from the beginning of the program, when we had implemented it, to 3 months after, which worked out to be about 7 months, we actually had 0 turnover in our CNA staff, which was pretty exciting as well. And here are some of the focus group responses from the CNAs. And you can really see that the themes of communication and teamwork, having more autonomy or control, and being more involved in the team really run throughout their responses. So just to end with the implementation pieces that are really important, and both Michelle and Sharon spoke about the importance of this. Incorporating stakeholders into each phase of the project is really key. And as I had discussed on the Northeast unit, the staff really felt a bit frustrated when it was just the CNAs and the nurses, because they didn't have the stakeholders there that they needed to implement changes that we felt that we needed. So that adjustment in how we were running the program really made a difference to them in the end. And again, having leadership and management support this, because I was pulling staff off of the unit to be able to do these trainings and these debriefings, and to have them fully involved was really important right from the beginning. And then anticipating that there are going to be barriers, and what plan you have to circumvent them, whether they're physical. At our facility, it being a Jewish facility, there were some cultural issues that we had to consider before we had implemented. But the really great benefit of TeamSTEPPS is that it really is so adaptable and flexible that we were able to make it work for our facility. And just as Sharon had said, enjoying, embracing the process, and really just appreciating the opportunity to bring something new to your facility. If you are implementing, the most important thing, as I say here, is being present, being there to be involved, being proactive about possible challenges, and just really maintaining a positive attitude, because challenge is hard for everyone, but it really makes a significant difference in the outcomes that you can achieve. So that's all I have. Thank you very much. I appreciate all of your time. I'm going to hand it back to Chris.
Thanks, Erin, and thank you, Sharon and Michelle as well. I really appreciate all of that. That was a great presentation. I liked that we were able to learn about the impetus for creating the long-term care version, and then how you get about getting started, and then some results, seeing some results. So I wanted to address here, there's definitely some questions that are coming in. A lot of people want to know how they can get this material and what they can do about it when they get it, and so I can answer those. and I'll start off. The materials are all available if you go to the AHRQ website and search for TeamSTEPPS in long-term care. And they are all there. All the materials are available to download, and the great thing about these materials is that you can customize them to work for your organization. So if you think that there's something special that you want to do in your organization or focus on something that we've always been very okay with is make this your own. You know, steal from it, do what you need with it. It's more about, you know, helping the residents and you know, make it your own. So all the materials are there. Now, as far as training goes for these materials, I think that it brings up an interesting question, and I'll definitely ask the speakers to jump in here. I think, personally, that if somebody has already attended a master training course or if they're already adept at TeamSTEPPS, the hospital version, I believe that by reviewing the materials in the long-term care version, by understanding the differences in environment and by understanding the different content that's been created, like the new videos, like some of the changes that have been made that Michelle has talked about, that a TeamSTEPPS master trainer could definitely train others using this version if they already know what they're doing with the hospital version. So do you, Michelle, have any thoughts on that since you were the one who was involved in designing it?
Chris, no, I would agree with you. I think if somebody is already a master trainer based off a hospital version, but is familiar with long-term care, understands the current culture, has worked in a nursing home, I think you can easily be able to take the materials, review them, and then apply them in training.
I think it's interesting to point out that actually here, both of our other speakers, both Sharon and Erin, Sharon received her training at a hospital course and is now using the long-term care version, and that Erin was using information from the hospital version and did a lot of her work before the long-term care version was launched. So it's definitely something that I think can be done. I think that brings up a point, though, and something that we're going to ask you in the future, those of you that are attending this webinar, is if this is something that all of you would be interested in if there were trainings made available that focused in on the long-term care community. So that's something that we will ask all of the attendees. One thing that I would like to ask the speakers is that if there was a training, an in-person master training course on long-term care, who would be the optimal people to come to a training? Would you invite, sorry, yes.
No, Chris, this is Michelle. It's a really good question. You know, it's really important within long-term care, as we heard from our speakers, that we're empowering the CNAs. And because this program, you know, TeamSTEPPS is really looking at every level within long-term care to be empowered to implement these changes and use these tools. I would love to see an interdisciplinary team come and do the training so that you have different perspectives as part of those key people in your facility that are implementing this change. With that said, it's also important that you have leadership on board, because if leadership is not going to support this and they're only just, you know, kind of sending someone to say we did something without actually seeing it through, it'll fail. So I think every organization is going to be different, and they need to really sit down and say what's going to work best for us in our culture.
That makes a lot of sense. Who are the change agents that need to be present?
Exactly.
So we, this morning, our computer system had a hiccup and sent out the evaluations for this webinar already, but when you complete the evaluations for this webinar, there will be questions on there about your interest in training. So definitely respond to those evaluations so we kind of know what the interest is out there. Okay, going into some of our other questions that we received from individuals over the discussion area. Erin, I'll ask you one.
Sure.
There was an individual interested in whether or not there was any sort of refresher training that you did during the process for on the tools and methods.
I didn't take a refresher course, though I had taken TeamSTEPPS several times before I went and became a master trainer. But I definitely reviewed the material, and actually I looked at the research surrounding TeamSTEPPS as I was working on my capstone. So that was definitely helpful. You know, there's lots of TeamSTEPPS offers a lot of the little tools, which are a quick review, things that you can carry with you, and that was really helpful in as reminders in developing my program. So.
Thank you, Erin. A question that was very specific about the tools was an early question. Somebody was wondering if there are any videos that included scenarios involving residents with dementia. And I know, and Michelle, correct me if I'm wrong, it doesn't specifically focus in on that, but there is a patient who is suffering from dementia based on another clinical thing that's wrong with her. Is that right?
Yes. In the long-term care version, we have somebody that has some mild cognitive impairment and then really starts to become delirious, and that's one of the key signs for the staff to say, oh, she's saying things that she wouldn't normally say. She's confused. So we did do that. I'm happy to say that we were just awarded another grant through AHRQ and APT Associates that we partnered with to create the long-term care version to create some more videos.
Oh,
because
great.
we recognize that we were limited within the first contract. So we do recognize that there needs to be more dementia and residents with dementia being represented. So we will work on that going forward. Thanks for the suggestion.
That's great news. Good. I look forward to seeing those when they come out.
Me too.
Okay, so let me see what else we've had here. So I guess I was curious for all of you, since this is a very different type of audience as far as those being trained could, as was seen in the cool little penguins, there are individuals, the chef, the people who are involved, like the chef and the housekeeper and others. Would you do something to customize or specialize your training for individuals in those professions, or would you recommend training everybody together in the interdisciplinary teams?
Well, this is Erin. I think there's a real benefit to having interdisciplinary groups when you're doing training to really understand the various perspectives of people in their fields. And, as we all know, if we work in long-term care, that, oftentimes the housekeepers are the ones that may come up to me and say, Mrs. Smith is having a hard time breathing. And I think that because there's so many different disciplines that work so closely in such small facilities, relatively, I think that is really a beneficial thing. And I think that the TeamSTEPPS material is broad enough that it's appropriate for all of the disciplines that we encounter and that we work with every day.
Thank you very much, Erin. Thank you. So all of these materials that you've heard about today, like I said, are available on the AHRQ website. This particular webinar is being recorded, so if you want to share it with anybody, you'll be able to find it at teamsteppsportal.org in a very short order. It takes just a couple of days for it to come in from our vendor, and we provide a transcript as well. And so that will be coming to you soon as well. And if there are any questions that have not been answered, we'll make sure to, like we said, answer them and put them up on the portal. just wanted to come up with a couple extra things here now that we're at the end of our time. We will continue to have monthly webinars through September 2014. So keep looking in your email. If this is your first time with us, please look at it and look for it and keep up with us. And we've got new topics every month. We have an annual conference in June 2014 in Chicago this year, and this is a great way for everybody to connect. You know, we're a big community, and we're big on everybody getting together and sharing with each other. I met 2 of the 3 speakers on this particular call through the conferences in the past, last year in Nashville and this year in Dallas. And then our 3rd speaker, we actually ran into people from her team at one of our master training courses. So become part of the community. We'd love to see you at the conference and to get involved with all of this. So there'll be more details about that conference coming. We invite people to submit abstracts, to present. So it's, I think, a lot of fun. It's a good 2 days. So I see that we've had some more questions come in. Unfortunately, we're at the top of the hour, so I have to end it right now, but we'll make sure to answer those. And please contact our team at the email address if you have any questions. So thank you very much, Michelle and Sharon and Erin. It was a pleasure having you today. I really appreciate it.
Thanks, Chris.
Thank you.
Thank you, ladies and gentlemen. This now concludes today's conference. You may disconnect your phone lines and have a great day.